We are Be Well Health and Wellness Consultants, and we're inviting you into our toughest and most honest conversations with each other.
We believe in honest, educated, science-based health promotion and that everyone should have access to this kind of information.
Tune in to hear our hearts for you as we uncover the not-so-pretty side of the health and wellness industry on the Healthy is Hard podcast. Hello, everyone. Welcome back to the Healthy is Hard podcast. We are so excited to be with you today. We're going to be covering the topic of inflammation. Make sure you stick around for the entire episode because it is going to be jam-packed, full of amazing information. But at the end, Tony and I are going to share our best tips for reducing and fighting that inflammation. So I'm going to kick it over to Tony to start us off. Tell us all that you know about inflammation.
All right. So when it comes to inflammation, and I know a lot of you always think inflammation is a bad thing, and a lot of people do. The medical field does. But information is changing. Science is changing. Like we always say every podcast, science is always updating. And there's good inflammation and there's bad inflammation. Now, with the bad inflammation, you're talking more on the chronic side of inflammation. We're talking arthritis and all those chronic illnesses, which could lead to further diseases down the road, which I know Bailey is going to touch on pretty soon. But I want to touch on the good inflammation because it's pictured as bad to a lot of people. And when I mean inflammation, I'm just going to use an example, and I'm going to be pulling a lot of this information. Bailey's going to have the link to this article down below. It's a great article. Like, you go follow them. They have great information. But I want to talk about small acute injury. Now, mostly injury, it can be from walking. Somebody older could be walking and they fall off of a curb and they twist their ankle, or it could be an athlete in the middle of a game and they sprain their ankle. Now, acute inflammation is a good thing. So Bailey, you've heard of RICE before, correct? Rest, ice, compression, and elevation.
Yeah, so I was a cheerleader and I lived by RICE because sprained ankle was the name of my game.
So that term, RICE, was coined by Dr. Gabe Merkin back in 1978. All right. Medical field picked that up. They religiously used it. All right. If you hurt yourself, ice, your parents, ice. Yes. But he actually came back in 2015 and reversed what he originally said back in 78. Ice is actually the opposite of what you want to do when you injure yourself. So I'm going to go ahead and start. Let's talk with a sprained ankle. So you sprain your ankle in the middle of a basketball game, right? Your ankle starts to swell up. The pain, mild to, let's say, a 6 to 7 on a scale of 1 to 10. The first thing a coach is going to tell you to do is slap a bag of ice right on the ankle to reduce the swelling and the pain. Mm-hmm. Well, here's the science behind why ice does not work. Inflammation is our body's natural response system to an acute injury. Inflammation, let's think of Pac-Man. You know how Pac-Man, he's going in and he's chomping all those white dots, right?
Right.
Pac-Man is what resembles what we have called macrophages in our system, all right? Those macrophages go into that acute injury area and chomp down all the dead cell tissue that's in that area. That is the macrophage's job. Now, let's use another analogy. If you use ice is going to be your roadblock on I-70 when you're trying to go to work and you're late. What happens when that roadblock is on there and you can't go there? That's literally the macrophages cannot get to where they need to go. All right. So you have your Pac-Man that need to go into the area and get rid of all that dead tissue, all right, from that injury. But that ice is what's going to limit that. All right. Over the years, they're always going to use ice on muscles, to save it. And I understand that. That's more for surgical terms. But if you want your injury to actually heal, ice is not the way to go. All right. Ice is definitely going to get the pain reduced, but is not going to fix the injury. Just like I said in our previous podcast before, You know, a biologic or a biochemical injection doesn't fix a biomechanical problem. It's the exact same thing. Now, when those macrophages go into that acute area, which is our ankle, we're also going to have another, which is called an insulin-like growth factor, IGF-1, which is going to go following the macrophages and try to start the second process, which is muscle repair and regeneration. All right. So we have our macrophages and we have our anabolic hormone, the IGF, which is going to rush into our ankle. Now, how does that get into that area? All right. So the inflammation in that area is caused by the blood vessels and those small capillaries that are surrounding that area to expand. All right. So that's what the swelling is, those blood vessels and those capillaries opening up. And now you have room for that little Pac-Man to go in there and start doing its job.
Right.
All right.
So when that happens, break it down here a little bit. When you have an injury or you have something that is inflamed, those blood vessels are opening up to allow something else to come in and do the job that it is supposed to do, and allow more blood flow around that area so that it can be healed faster. So that may be a more familiar concept to a lot of people. So then those macrophages come in, and then the IGF starts to get pumped around, and now we're back in the game.
Mm-hmm. So, and the biggest thing is, and part of next to the ice before that is rest. All right. But you technically, when it comes to any type of body movement, you never want any portion of your body to just sit still. I don't care if you do have that big ankle, find a way. If you need to mechanically push the ankle, you need to keep it minimally mobilized. All right. Because if you don't, it's just going to sit there. And facts stated, like I said back in this article that you'll be able to read, you could potentially each day lose up to 0.5% muscle because it's not moving. Your body's stopped trying to rebuild and repair that muscle. It's just sitting there being useless at that point. So minimal mobilization, all right, bearable enough that you can handle, obviously, because swelling does cause a lot of pain and it does allow a little less of range of motion in that area of the injury. So if you can avoid ice, definitely try to push through that pain and try to mobilize that area. Now, swelling can be a bad thing over a long period of time in like a joint area. All right. So say your ankle, you've had swelling for 3 to 4 days now. That could be a problem with your lymphatic system. All right. Your lymphatic system, all right, is a way to get rid of waste. That's what the main purpose of the lymphatic system is throughout the body. So if you have swelling that basically is just waste byproduct sitting in that injury and it can't go out the way it came in, therefore it has to go through the lymphatic system to get out of the body. Mm-hmm. So try to use those little analogies. You have the Pac-Man, all right, the macrophages, and the IGF-1, which is the insulin-like growth factor of the hormone. Our body wants to get in there and get to work, but that ice is the roadblock. The ice is not allowing our body to naturally heal itself.
The ice is the ghost in Pac-Man. When you run into the ghost, it shuts you down and you have to start over. And that's what happens. You prolong actually the recovery of the actual injury itself. It may feel better to do the ice and the rest. However, you're not going to maintain the same strength and mobility and ability for your body to heal itself if you are doing what we have been taught for a long time.
Yeah. So if you injure yourself and you just let it sit there, you're not mobilizing it, all right, and you're icing it, you're just delaying the whole healing process. All right. Then when the time comes where you've pushed back. I know athletes, their goal is to get back into the game as fast as possible. Right. You do see a lot of athletes putting ice on the area, but that's something you technically don't want to do. They just do it because the pain is probably unbearable. All right. But what's more important, fixing the problem or just alleviating the pain at the moment? The goal should always be fix the problem. And but that's my opinion. A lot of people, oh, please just get rid of the pain for me. I totally understand that. All right. But that's something I try not to push, because you should let your body work to its fullest potential. All right.
Right. So at the end of the episode, we're actually going to talk about some other ways that you can reduce inflammation. So kind of fight that at the same time as it's happening. So at least from the nutrition standpoint, there are definitely ways to treat swelling and pain without ice, which is really, really cool. But I have a question for you. So I want you all to know that I have not heard of this before either. So this is the first time that I'm hearing of the sort of anti-rice movement here. So I'm learning right alongside of you. I was always taught the rest, ice, compression, elevation when you get hurt. So Tony, I have a question. If you're doing the rice method, is that potentially, did this article touch on if that is why we see a lot of recurring similar injuries in athletes like the sprained ankle?
Yeah, because if you do rest and you don't mobilize, your muscle can then just start to die off. It cannot. Remember how I said you will need that IGF to start that muscle repair and regeneration?
Uh-huh.
Just like the Pac-Man, you're stopping that hormone from going to the area and repairing that muscle. Therefore, that muscle is just going to go to waste. So you could see acute injuries because somebody's not as strong as they were in that area based off of you icing and resting that. And I actually, talking of the rest, I have a small analogy that is shared from this article that I've been pulling from Squat University. So this is kind of a great picture to think in your head. If you knew it was going to snow 2 inches every hour for the next 12 hours, what would you do? You'd likely open your front door and brush off a small amount of snow with a broom every hour. If you procrastinate and wait until the next day, you'll open the door to find 24 inches of accumulated snow. Imagine how much more difficult it is to shovel 2 feet of snow all at once. That analogy can literally think of you resting and icing for 2 to 3 days, right? And letting it all build up. And now you're trying to fix that problem at once. And now you have an even bigger problem. Does that make sense?
It makes a lot of sense. And coming from the kind of preventative medicine side, it actually makes a lot more sense than using ice as kind of a treatment method. So very, very interesting there. Very cool to hear that new science, and especially to hear that it came from the same doctor that was, as we preach and praise on in a lot of different episodes, it is very hard to do, to kind of go back on yourself and be like, hey guys, gotta change my statement there. That's definitely a big move and something that we really respect around here.
And here's the biggest issue with that whole RICE acronym is you see how impactful it was when it first came out. Like I said, it's religiously practiced every single day. But since 2015, how many people have heard of what I just said? Probably none. I remember when my sister was moving in, right? My aunt and uncle came to help. The headboard fell on her toe,
Ooh.
right? First thing she wanted, I need ice. I was like, no, you need to do a little crunches with your toes as slowly as possible and just let your body do it thing. Because her foot swelled up, right? You could tell she easily just broke that toe.
Oh.
But my mom, my uncle, my sister, my dad all fought me saying, no, she needs ice, not knowing they've never heard of that before, of what I just said for the last 10 minutes, right? So I want this to be information that we can push along for people to hear and actually think, wow, that actually makes sense. Because a lot of people just think the quick fix, like the main topic, healthy is hard, and quick fixes are easy. So the whole purpose of this is to get the best and truest results possible.
100%. So here's your challenge. If you just listen to what Tony said and you have not heard of this science yet, y'all, it's 2021, fresh out the gate. And this has been, the studied, accepted answer since 2015. So if you have not heard of this new kind of method of, I guess we should probably call it, I don't know, I guess, rehabbing, working through the pain to heal yourself. Your challenge is to go ahead and share this episode on your social media pages and tag us, or send it to a friend, take a screenshot and send it in to us. We want to know who you're sharing this information with, because when you know better, you can do better. And we believe that by helping to educate you, the listener, that you can then go out and make a difference. And together we can make such a massive change in the health and wellness of our world. And we think that's really cool. You have a lot of power in all of this. So we encourage you to use that power, share this episode with a friend or 10, so that they can know a little bit more about how their body works.
Awesome.
Very, very cool. So moving into the latter part here, from the nutrition side, I typically see inflammation after it's already occurred, and unfortunately after it's been there for a very long time. So especially when we're looking at inflammation in the joints, and within even the lymphatic system, as Tony was mentioning earlier, that's the inflammation that we don't necessarily want to see. And that type of inflammation has actually been linked back to a trigger or an underlying piece of nearly every chronic disease. That includes heart disease, diabetes, autoimmune disorders. Anything you can think of has a relation back to inflammation. A little story that I have with this, I had a client this past summer who came to see me, and she was diagnosed with 4 different autoimmune disorders. Now, she definitely had them. She had the symptoms of all of them, and they ran all the tests. But the interesting thing to me was that each of those 4, yes, you heard me correctly, 4 autoimmune disorders, was that they are all marked by causing inflammation in different areas of the body. So her issue was not the autoimmune disorder. Her issue was the inflammation. And once we started to put her on an anti-inflammatory eating plan, moving a little bit more gently with her body, she started to notice a reduction in symptoms in every area. So that's the most important thing when talking about inflammation, is attacking the root cause of it, when it's not necessarily related to that acute injury. You want to think of it in the same terms. It is all the same process within our body. We do recognize it as the same thing. It just has different causes. Some of those other causes we accrue every single day. Different things like our food choices, the supplements that we choose to take, and the quality of those. Different types of exercise can produce inflammation, pollution, radiation exposure from our phone, from the microwave, the TV, seriously, so many things. The air you breathe, depending on the pollution level, can increase your inflammation level. So there's honestly no true way to escape inflammation in the age that we live in, but there are lots of ways that we can help reduce and even eliminate the inflammation that has already occurred. So is that all kind of making sense? I know inflammation is a very highly talked about issue, and it's one that people like to throw a lot of quick fixes at, which is not necessarily the best thing for you to do.
Yeah. I know, I want to ask you, I know myself, I'm a little bit, as far as food and spices,
Mm-hmm.
a lot of you got, I know pineapple is a fruit. That's a good anti-inflammatory. You have turmeric as the spice. That is a good anti-inflammatory. What else can we consume to naturally get that inflammation down, rather than popping that pill that the professional just threw at us?
Speaking my language now, we're going to get into it here. I love it. So the very first tip that I have, like I just mentioned, you have to stop with the cleanses and the diets and the shakes and these quick fixes, okay? I know there are a lot of diets aimed at, marketed towards reducing inflammation, which is why they gain popularity so quickly, because as I just mentioned, everyone experiences inflammation, and most people are aware of that fact, but they aren't aware that by throwing a lot of different things that don't necessarily work at your body, you're really just freaking your body out. Your organ systems are gonna be like, hold on, sister, friend, brother, what is going on? What are you doing to me? I need consistency. The body, the brain, the organs love consistency, okay? So that's why when you're taking a multivitamin, you want to speak to a professional, someone who is trained on supplementation, get a recommendation from them, and then take that as often as they prescribe or suggest it, and keep it that way. Don't wait till you run out of the bottle and go try another one or add in 5 other vitamins on top of that. Choose something, stick to it, allow your body to exhibit its natural tendencies and fix the issue. Okay, so that is the first piece of advice I have for you. There is an actual nutrition protocol that we will use on patients like the woman I just mentioned. When you have a severe chronic condition, there is something called the Anti-Inflammatory Diet. It is incredibly important that you hear me when I say you need to be working with a nutrition professional and a doctor to make sure that you're being safe when you're doing this, okay? When you're talking about reducing inflammation, you are often talking about increasing blood flow as well. If you have any underlying conditions, that can be very dangerous. If you are on any medications, it can become very dangerous. So, number one, stop the quick fixes. The cleanse products are literally, there's nothing in them that has anti-inflammatory effects, so they're not helping you. I can almost assure that. If you have a product that you would like for me to review, please send it in and I would be happy to give you some suggestions on it. However, the ingredients that you are going to want to be looking for, top 3 anti-inflammatory foods. If you have a notebook or pen or recording option on your phone, go ahead and pull those out. Number 1, Tony said, my very favorite friend in the kitchen is turmeric. Turmeric is, they call it the golden spice. It is seriously just so good for your body. I will say that turmeric is a little bit earthy. So I like to put it in my eggs every morning, but it's definitely not something that you're going to want to put in like sweet things or yeah, you probably could, but it might taste like dirt. Being completely honest, all those health benefits do come at a little bit of a price with the taste, but I find that putting it in things like your eggs, again, or even a salad dressing can really help mask that flavor and just give you the nutritional benefit without the dirty taste. Because that really
get on your countertop.
Yeah, I honestly imagine like if I went outside and like licked the ground, that's probably, it has the same taste, because I have tried like just turmeric before just to see like what's it like, because I have to be able to share this information with you, right? It's not good. I do not recommend it. It's not very fun. It's great for your body. However, so these things that I'm sharing with you actually come from what we call the Inflammatory Effect Score Chart. So turmeric actually has the most highly negative value on that chart, which tells us that it's the most powerful anti-inflammatory agent. So I coach all of my clients through this Inflammatory Effect Score Chart because it's just such a great resource. But if you do go out and search for it and find it, it is a little confusing if you don't know what you're looking for. So again, we're always here to help, but just know that's what professionals are for. Be careful, because if you read it incorrectly, you run the risk of increasing your intake of highly inflammatory foods, thinking that they have that anti-inflammatory effect. And of course, then we run into a much larger issue. So number 2 on that list is flavones. That's Flavones. And flavones come from the white pigment in fruits and vegetables. So you are going to find flavones in things like white wine, green tea, potatoes, bananas, green grapes, all those light white options that people love to tell you are bad for you. They are higher in sugar. They're higher in fructose, glucose. That's just how it works. However, when paired with the third most powerful anti-inflammatory agent, which is fiber, flavones have an incredible impact on your inflammation. So always come back to the fact that fiber is literally so important because it binds to those sugars and helps release them over an extended period of time, which helps us regulate blood sugar. That is why you should always be choosing a fruit or vegetable over a juiced product or a powder product. So, top 3, turmeric, flavones, and fiber. To get back into the flavones just a little bit, you do, of course, want to practice those in moderation. When we're talking about this anti-inflammatory score, I'll put it in terms of numbers for my statistics people. Turmeric has an anti-inflammatory effect score of about 750. Flavones come in about 650, and then fiber comes in about 460-ish. So those are the general areas that we're working in. Everything else typically falls within the 0 to 200 range. So those are very powerful anti-inflammatory agents. You can use those to reduce some of the inflammation that we accrue throughout the day. And if you use them, each one in moderation, because of course you don't want to overuse the flavones. There's a lot of sugar in the white wine. Overuse of alcohol is never a good thing. You know, overeating your potatoes, you're gonna overutilize those carbs, which can then turn into adipose tissue. With the turmeric, you actually run the risk of depleting your iron stores within your body if you consume too much. So like everything, please practice in moderation. We just want you to be safe and utilize these as tools because that's what they are. You can use it to be a good thing. Now, if you are way overly concerned about inflammation, please don't go ham on all of these suggestions that I just gave to you. These are not for everyone. If you have iron deficiency already, maybe turmeric's not the best way to attack it. If you are a recovering alcoholic, obviously you want to stay away from that white wine, the red wine, some of those antioxidants that can help reduce inflammation, but may have a potential negative effect for you specifically. We can help you. We are always here to give you other suggestions. Again, talk to your doctor, talk to a nutrition professional. There are ways to kind of go around this and utilize all the foods that we have available to us to really hone in and add up those negative points to counteract the inflammation that we are gaining every day. So does that help a little bit?
Yeah, definitely. I was surprised when I heard the fiber and the flavones or flavones, right? Flavones, yeah. I've never heard fiber really having an anti-inflammatory effect, or I've never even knew what flavones was. So
yeah, and that is something that I really love to share, and that's why I go through it with all my clients, because one, it's just fun and cool information to learn. I mean, who the heck knows what Flavones are? You're going to sound so cool the next time you go to a party, if we're ever allowed to go to parties again. And you tell someone that their white wine has antioxidants and anti-inflammatory properties in it. Very cool. Now, I do want to point out with that alcohol actually has a mild inflammatory effect, but it can also have a mild anti-inflammatory effect. So it all depends on the amount. If you consume about 1 glass, you're going to reap the benefits of both the flavones as well as the anti-inflammatory effect of alcohol. Once you surpass that 2-glass threshold, that's when you'll start to switch over and increase inflammation. So again, lots of information. Balance is key always. And the final tip I actually have to leave you with is that one of the most powerful ways to reduce inflammation and reset all of the body processes that actually allow us to heal the inflammation and anything else that's going on in our body is to get more and better sleep. So shutting off that phone an extra 30 minutes before bedtime, getting some blue light glasses to reduce your blue light time just before bed, using, meditation, breathing exercises, reading, whatever helps you sleep. And actually, another fun nutrition fact is that almonds and cherries actually improve your production of melatonin. So those are great things to throw in as an after dinner snack or dessert. Be sure you stick with the serving sizes of each of those, but they can help your body produce melatonin and get you to sleep faster and help you stay asleep.
Interesting. Okay.
Interesting.
So,
very cool.
Portion sizes, know what foods can affect you with your inflammation issues, what can help with your inflammation issues. And on the fitness side of things, mobilize, do not rest, and don't ice.
Mobilize. We need to come up with a new acronym.
I do. I was going to show a little example of like how mobilizing, like you can find a way to mobilize even through an injury. Do we have 2 minutes? 3 minutes?
Yeah, we have 2 minutes.
So example, as far as mobilizing. All right. So let me use an example of a rotator cuff surgery. All right. You're in a sling for how long? Probably before you can even start physical therapy, you're probably in a sling for 2.5, 3 months, maybe, because that surgery. It might be shorter. I'm not too sure on the time wise that you're in a sling for, but
it's generally long time.
Yeah, you can't move that shoulder because of the repair that it did from the surgery, but that doesn't say you can't mobilize your scapula. All right, people never think that. They just say don't move it, right? But your scapula, which is your shoulder blade, if nobody knows what that is, it follows where the shoulder goes. So if I am naturally protracted, if my shoulder is rounded forward, if I've rounded forward, your scapula is going to round forward with the shoulder. Now, if you have nice posture, your scapula is going to sit in a nice, perfect position that it should naturally be in. Now, as far as mobilizing the scapula, if you are in a sling for rotator cuff repair, you can literally stand here. Now, if you simply just hinge at the hips, your shoulder and your rotator cuff is naturally just going to fall forward, literally just from bending at the hips. And if you want to do the opposite, you just bend back and your scapula will then retract. So your shoulder joint is not moving based off your shoulder movement, but by moving your hips, because there is a connection to your shoulder and your hips, which actually is another interesting article to read, how hip immobility can cause rotator cuff injury in a baseball player. So that is interesting as well.
Another topic for another day.
That just shows you that mobilizing is so important, even when people say to rest and don't move it so it can heal. Mobilizing it might actually increase the speed of recovery.
Interesting.
So science is always updating.
Science is always changing, and I hope you all know after today especially that you can always come back here for the most up-to-date science information that we have. So that was an amazing episode. lots of really great info there. I encourage you to go back, listen again, take notes, especially if you're in the car. If you are like me and heard that end part, go the rest of the day and sit up straight with better posture. But thanks for tuning in, guys. We love to share stuff with you like this. I hope that you could hear our excitement to learn from each other and help educate you. If you have any other topics or questions that you want us to answer on the podcast, send them in to our social media accounts. You can find us at bewellphc on all platforms, or you can visit our contact page, which I'll link in the show notes if you have additional questions. Tony, thank you so much for sharing that article. It was such eye-opening information.
If you get time, definitely read the entire thing. I don't know as far as how many pages. It could be like a 3-page type of essay. Take that 20-30 minutes of your time to read it, because it'll stick to you for the rest of your life and you'll be very shocked.
Absolutely. Make that time investment in yourself. Investing in your health does not always have to include money or groceries or going to the gym. Sometimes it's just sitting down, leaning into a podcast or reading an article or reading a book, and then checking back with a professional to gain their opinion on it. So that's one of the best investments you can make. And we already know that you are interested in making those because you are here with us. Stay safe, stay healthy, guys. We will catch you next time on the Healthy is Hard podcast. Can't wait. It was our greatest honor to take up space in your world today. Please share this episode to your social media pages and tag us at bewellhwc. Cheers to you, friend, for choosing better for yourself starting today. It won't be easy, but it'll be worth it. Subscribe to the show and learn how to make healthy less hard, one tip at a time.